So first things first, when are you eligible for Medicare? So Medicare begins at age 65. So essentially the month that you turn 65, the very first day of that month, your Medicare will start. You can be eligible for Medicare if you're disabled or other specific conditions are met as well. Medicare is individual coverage. So, if you're 65 and your spouse is 63, your eligibility does not equal your spouse's. So the 63-year-old would not have access to Medicare until they turn 65. So let's say, staying with that same example, what do you do with your 63-year-old spouse? So you cannot keep a spouse on your employer plan. If you turn 65 and say, I want to leave my employer plan and go on Medicare, you cannot keep your spouse on that plan. So there are options for spouses, again, and with the 63-year-old we're talking about. They can get group coverage from their own employer if they are working. They could take COBRA if that's available to you, or purchase an individual plan from the marketplace. I will mention here, though, that what we see most people do is the 65-year-old would choose to delay their Medicare until the 63-year-old turns 65, and then they would both go on Medicare at that point. So important things to note. So on the flip side, what happens if both spouses are eligible for Medicare at the same time? So the best option is you both just start on Medicare. You can continue to work and be enrolled in Medicare. There's a couple of caveats here. If you want to stay on your employer plan and you don't have an HSA, we have videos about this. So go ahead and check out our page. You can delay your Medicare, or you can go ahead and take it if you're not on an HSA type plan. And what we're talking about taking is really the Medicare Part A. You wouldn't want to take the Part B because there is a premium associated with that. So these plans are all individual coverage. So when we're talking about your Medicare, you're each going to have a Medicare plan, and then you're each likely going to have a Medicare supplement, Medigap plan, or a Medicare Advantage or Part C plan. So the one thing I do want to mention is that some supplement plans or Medigap insurance, some of the insurance companies offer a discount. So essentially, if both spouses were on a Medigap plan with the same insurance company, some of these folks, if they live in the same household, they would offer between 5 and a 12% discount on your monthly premium. These monthly premiums are in the hundreds of dollars, so it does really help out. So that's important to keep in mind. Advantage plans are generally low to no monthly premium, so discounts aren't necessary with these. I will mention here that a lot of people think, okay, I want to be on the same Advantage plan as my spouse just to keep things easy, so we know the same coverage and whatnot. But typically what we see is we're going to recommend the plan that's right for the individual's needs. So if you don't take the same drugs or see the same doctors, you might be on different plans. All right, some Part A tips for spouses. If one spouse has worked 10 plus years or 40 quarters and paid Medicare taxes, both spouses will qualify premium free for Medicare Part A. There's some marriage and divorce rules that also apply here, but just think of it easily like that. The 40 quarters is 10 years. Another thing that's worth mentioning is I talked about the health savings account or the HSA earlier. So you need to, essentially what they're saying is if you're taking Medicare Part A, you can no longer contribute to a health savings account. So you need to stop HSA contributions 6 months before your Medicare effective date. So this is really important if you're enrolling in Medicare after you turn 65. Let's say you're with the same example that I mentioned earlier, and you're 65, your spouse is 63, and you choose to work 2 more years until they turn 65. You both go on Medicare at that point. You would need to stop contributing if you had an HSA 6 months before you're planning to enroll in Medicare, so maybe 66 and a half as an example. Or the other option is if you're enrolling in Medicare right at 65, you just need to stop your HSA contributions by the first day of the month that you turn 65 to avoid tax penalties. So planning ahead, things that we want you to keep in mind. Really the goal of this is just to ensure continuous coverage. You don't want to have a gap in health insurance. So consider facts like the timing of your retirement. Looking at your spouse, looking at yourself, looking at some of these HSA rules I just mentioned. Really keep that in mind. Retirement is not a requirement for Medicare. This is a question we get not as frequently as the spousal question, but this is a question we get quite frequently. Really what it boils down to is your healthcare needs, the prescriptions you take, what doctors and hospitals you see that are important for you to continue to see, and your finances. So at the end of the day, we're here to help. If you or your spouse are approaching Medicare eligibility and have questions, just reach out. We're happy to answer any of the questions that you have. Navigating these decisions can be complex, but you don't have to do it alone. And really, our team is here to provide that personalized guidance and, tailor your options to your unique situation. If this has impacted you, whether you delayed Medicare or your retirement or something along those lines because of a younger spouse, let us know in the comments below.